All right, so COVID cases are surging across the country, guys, including right here in Georgia, and the numbers rising and breaking records daily. But are the recent rise in infections due to weeks of Black Lives Matter protests? That's the question that many people are asking us. Well, our Verify team checks the data.
Current research suggests there has not been a surge in COVID-19 cases caused by protests over the killing of George Floyd. Researchers at the National Bureau of Economic Research found that cities with protests did not deviate much from their expected caseload as was projected. Those same cities experienced similar trends as cities without widespread protests. Those same researchers found that people who didn't participate in protests stayed at home more once protests started than they did previously. This meant many counties where protests took place actually saw no change in or more social distancing once protests started. The researchers believe this is why there hasn't been a surge in cases tied to protests so far. They also proposed a few more ideas that could contribute to this. One idea was that many protesters mitigated spread with face coverings, and another was that protesters were less likely to get tested because of mild symptoms. They said these trends are not necessarily applicable to everyone and that they looked at the population as a whole. They believe it's possible that there could be an increase in COVID-19 case growth among protesters, but not the general population. However, some cities have tested protesters specifically and found few COVID-19 cases. In Seattle, Boston, and Minneapolis, the positivity rate of these tests were equal to or lower than that of the general population. The health officials of these cities told news outlets they believe that face coverings and the outdoor environment of the protests help mitigate the spread.